Hello, I'm Richard Laing and I'll be teaching GH756, Analyzing Pharmaceutical Systems. In this course, we take you through a whole range of methods and manuals that exist for looking at how pharmaceutical systems can be assessed, can be evaluated. I developed this course when I first arrived back from WHO at BU around the idea of preparing pharmaceutical track students in particular for work in the pharmaceutical sector. And I took as a model a job description from Management Sciences for Health that was looking for a program associate and what the sorts of things they would do. So in this course we start off by looking at what are the existing resources available in WHO and other sources as well. Then we talk about a book called Managing Drug Supply. This is called the Yellow Bible, and it's used throughout the world for pharmaceutical systems management. Then we talk about pharmaceutical country profiles, and this is a system of collecting standardized information that WHO has done. Then we talk about a whole series of facility-based survey tools, and to use those tools we need to spend one session talking about sampling and sampling methods. Then the survey tools that we use is investigating drug use in health facilities and investigating drug use in communities. Then we talk about qualitative methods, the range of qualitative methods that can be used to look at aspects of medicine's use, and here we'll cover structured observation, in-depth interview, and focus groups. Then we talk about measuring price, availability, and affordability of medicines, and for this it takes a little bit longer because we go through it in theory, and then we have you survey pharmacies close to where you're living, and you look at prescription medicines and you look at over-the-counter medicines, and then in the next class you spend time entering the data and producing a report or producing a summary of what your survey's done. In this year's class, 2 of the students have taken the data and are working with me to develop a paper for publication about medicines, prices and availability in the Boston area. Then we talk about how do we conduct analyzing selection systems. How do we look at how medicines are selected and what medicines they've got? And then procurement and procurement systems. And for that we use a case study from the Palestinian territories. UNRWA, the United Nations Refugees and Works Agency, have a very good system of procuring medicines, and a colleague of mine from Amsterdam undertook an evaluation of their system, and she'll talk about how that system was done. And for the classes at the end of the course, we use Skype video to Europe, to people in Europe, and they come online and they teach the class with the PowerPoint slides and answering questions and having a discussion. And that's why the class is at 10 o'clock in the morning, so that it's 4 o'clock in the afternoon in Europe when we do that. So we'll do procurement, we'll talk about assessing medicine systems for non-communicable diseases, and then we'll also look at adherence as an issue. How do you measure adherence, how do you intervene, and how do you change it? And then at the end of the class we'll break you into groups and give you an opportunity to put together a proposal for a specific country on undertaking one of the surveys that have been done in this way. A lot of the work that will be done in this class is weekly reviews, that when we give you a manual, you'll either review the whole manual if it's small individually, or if it's a larger manual, 2 or 3 of you will divide it up and write a review. And those reviews from last year will be shared with you. And so it's a bit like TripAdvisor. You'll have a chance to see different people's points of view about the manual, and you'll see that. I'm also hoping to mount this course as a distance learning program in South Africa with the University of Western Cape. So I'm hoping your reviews will be shared with those students, and their reviews will be shared with you in this way. So the course is quite busy, but if you work hard, it's easy to do well, and it's easy to get a lot out of it. And I think the students this year appreciated the opportunity for this practical experience. I would encourage you to have a look at their student evaluations, and you'll get quite a lot of useful hints about what you need to do to make the most of this course. So it won't be a terribly big course. I think we'll be probably 12 to 15, but we'll work well together, I'm sure.